Have you ever felt more forgetful than usual and thought, maybe it's just age? But what if it's not age, but your medications? Yes, what you take every day to sleep, for pain, or for allergies could be clouding your mind little by little, without you even noticing. And the most shocking part, many of those drugs are probably in your medicine cabinet right now. But don't worry, this video isn't here to scare you, it's here to give you tools. We're going to talk about which medications can affect your memory, how to identify them, and, most importantly, what safer alternatives exist. So if you care about protecting your mind and your independence, because mental clarity is priceless, subscribe now and activate the bell, because what you're about to hear might change the way you see your medications. The truth no one tells you after 60. Let me give you a quick test. Count with me. 1 pill for blood pressure, another for cholesterol, something to sleep, something for the stomach, and another for pain. 5 or more? Then you're not alone. In developed countries, 4 out of 10 people over age 65 take 5 or more medications a day. That has a name, polypharmacy. The problem isn't just the number, it's how they interact with each other. Imagine your body as an orchestra. Each medication is a musician. 1 sounds good, 2 or 3 harmonize. But if you have 10 playing at the same time without a conductor, the result is pure chaos. That chaos has a name, drug interactions. Some medications amplify each other, others cancel each other out, and others simply confuse the brain. And the worst part, they do it so slowly you don't notice until you start forgetting small things. How your body changes with age. Here comes an uncomfortable truth. At 70, your body doesn't process medications the same way it did at 50. Your liver and kidneys, the body's recycling plant, work more slowly. So medications stay in your system longer. What used to leave your body in 6 hours can now take 12 or 24. And your brain, more sensitive than before, feels it. That's why that antihistamine that used to make you only a little sleepy can now leave you confused for half a day. In fact, between 20% and 30% of adults over 65 take a medication considered potentially inappropriate. And it's not your fault. Medicine evolves faster than prescriptions. That's why today, more than ever, you must be the guardian of your mental clarity. Not a passive patient, but the protagonist of your own health. The memory-stealing medications. Let's get to the point. There are 3 major groups of medications associated with memory loss, confusion, or brain fog, and I promise you'll recognize more than one. Group 1, anticholinergics, the silent thieves. What do a sleep pill, an allergy pill, and a bladder pill have in common? They can all block acetylcholine, the key neurotransmitter for memory. Sounds technical, but think of it this way. Acetylcholine is like your brain's Wi-Fi. If you block the signal, the connection becomes slow and confusing. Clear examples. Diphenhydramine, the typical antihistamine many take to sleep. Oxybutynin for overactive bladder. Amitriptyline for nerve pain or fibromyalgia. Chlorpheniramine, the classic allergy pill. And the interesting thing, many are sold over the counter, so you may have been taking them for years without knowing the harm they can do to your mind. 3 warning signs. 1. A mouth as dry as the desert. 2. New or worsening constipation. 3. Persistent brain fog or forgetfulness. If you've got these 3, your body's whispering, check your medication. Safer alternatives. For allergies, loratadine or cetirizine. For sleep, first understand why you aren't sleeping. For bladder issues, pelvic floor exercises or reducing caffeine. Don't throw your pills away. Talk to your doctor. Every point you lower from your anticholinergic load is a memory you recover. Group 2, benzodiazepines, the calm that comes at a price. What if that pill that helps you sleep is teaching your brain to forget? Benzodiazepines, like lorazepam, diazepam, Valium, or alprazolam, are effective, yes, but their calming effect comes with a cost. They reduce the brain's ability to form new memories. It's like living important moments with your camera out of focus. They also increase the risk of falls by up to 60% and cause dependence. Stopping them abruptly can be dangerous. Always do so with medical supervision. Real alternatives. Cognitive behavioral therapy for insomnia, as effective as pills. Exercise, meditation, breathing techniques, daily walks. Slower, yes, but deeper and longer lasting. Think of benzodiazepines like crutches after a fracture. They help, but they're not meant for life. Group 3, gabapentinoids, the false, safe alternative. Have you heard of gabapentin or pregabalin? For years, they were marketed as safe pills for nerve pain. But recent studies show they may increase the risk of cognitive problems by up to 40%. They work like a blanket over your nerves. They silence the pain, but also your mental clarity, and the higher the dose, the thicker the fog. Effective alternatives. Specialized neuromuscular physical therapy. Pain management programs combining movement, meditation, and therapy. And if medication is needed, there are options that are gentler on the mind. The conclusion, sometimes it's not age making you forget, it's the treatment. Group 4, opioids, the hidden price of relief, tramadol, oxycodone, morphine. These medications relieve pain but slow the brain. Using them for more than 90 days can increase the risk of cognitive decline by up to 30%. And worse, they cause tolerance and dependence. You need more and more to feel less and less. If the pain is chronic, the safest strategies are adapted physical therapy, mindfulness or electrical stimulation, TNs, occasional anti-inflammatories, always supervised by a doctor. Because if you calm the body by shutting down the mind, you're not winning. You're paying too high a price. Other suspects in your medicine cabinet. Quick round. Corticosteroids like prednisone. Helpful, but long-term use can cause confusion. Beta blockers, great for the heart, but may cause mental fatigue. Topiramate can literally make you forget words. Old antacids, cimetidine. Risk of confusion? Omeprazole. Doesn't affect memory, but can lower B12 with long-term use. Statins. Relax. They do not cause dementia. They actually protect the brain. The problem isn't the medication. It's how and how long you use it. Your step-by-step action plan. Now that you know all this, what can you do? Step 1. Quick audit. Put all your medications, including vitamins and natural ones, into a transparent bag. Take it to your doctor. The visual impact is worth more than any list. Step 2. 3 key questions. 1. Does any of these block acetylcholine? 2. Do I still need all of these medications? 3. What would you do if I were your mother or father? That last question changes conversations. Step 3. Never stop anything abruptly. No stopping pills suddenly. Benzodiazepines, antidepressants, or omeprazole require gradual tapering. Step 4. Build while you reduce. Replace. Screens with a sleep routine. Anxiety with 4 to 7 to 8 breathing. Pain with conscious movement and physical therapy. And the best part, cognitive side effects are reversible. Your mind can clear in weeks if your medication is adjusted correctly. The message that should stick. Let's close with 3 ideas. 1. Some medications can cloud your memory. 2. There are safer alternatives. 3. You and your doctor are a team. Today, look at your medicine cabinet and ask yourself if you truly need each pill. If this video helped you, subscribe now and activate the bell for more clear guides. Share it with someone who needs it and comment, "I protect my memory." Your mental clarity is non-negotiable. Aging is inevitable. Living with a sharp mind depends on you. Take care and see you in the next video.